The Trump administration is facing a setback with a quarantine facility it's set up to help Americans exposed to Ebola. As Garrett Tenney reports, it comes as cases continue to climb in Central Africa.
Enhanced border screenings across Central Africa as an Ebola outbreak in the Democratic Republic of Congo intensifies.
There are multiple strains of Ebola, and this strain is the one that's a little bit more rare.
Now, a court in Kenya has temporarily suspended the Trump administration's plans to open a quarantine facility in that country for Americans exposed to the virus. The 50-bed center was scheduled to open on Friday, but faced legal challenges over cross-border infection risk.
There had been no transparency around impact assessments, around contingency measures, around the procedure by which this was approved.
It comes one day after Kenya's government provided written approval for the site as part of a coordinated public health response with the U.S. that Secretary of State Marco Rubio says includes more than $13 million for the East African country's Ebola preparedness efforts.
The State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located.
So far, Kenya has not recorded any Ebola cases, but in Congo, the World Health Organization says the outbreak is growing faster than the response efforts can handle.
There are many challenges, especially in containing this outbreak. It's a very complex outbreak.
4 U.S. airports are screening Americans arriving from affected countries, but health officials say the risk to the public as a whole remains low.